Okay, so we'll make a start, and I think probably the best thing is if I make these the slides available, and we've just pressed the record button, so I imagine that this will be available. The presentation will be available later for people who've struggled to get in. So welcome everyone. This session we're going to focus on sustainability, health and social care, and in particular we're going to focus this webinar on resources and the potential scarcity of resources. So I've put up on the first screen has got the chat room address, so if you can log into the chat room, that would be excellent, and I'll come back to the chat room at the end, because I think we'll be able to do some more work and discussion in another day to follow on from this session. Okay, no, my slides are not transitioning.
Probably need to try using the keyboard. No, perhaps you click on there first, or get rid of this by putting it over there. Now try.
Okay.
Gremlins.
There we go. Okay, that's it. Okay, so the learning outcomes for this particular session are up on the screen. So by the end of this block, this session and the chat that follows, we'd expect you to be able to identify a number of scarce natural resources that could have significant impacts on health and social care should they no longer be available, and we'll talk a little bit in detail about what those resources might be. You'll be able to identify some possible solutions to resource challenges, and particularly through multidisciplinary working, and also be able to report any blocks and enablers to reducing, reusing and recycling health and social care waste. Okay, so hopefully by the end of the session you'll have some idea of how to do that. What I'm going to do is talk about a research program that myself and colleagues have been involved in, and this links to the work of the Sustainability Society and Health Research Group, which you can access through the university website. And this is a program of work around scarce resources and waste management in health and social care. And it started with a qualitative feasibility study, which was really an interview study that looked at how attitudes, belief and knowledge can contribute to a reduce, reuse and recycle approach to healthcare waste and waste management. And this was a study carried out in Cornwall, which involved interviewing a number of people who had specific responsibilities or input into managing waste. And one of the things that was particularly interesting about those interviews was that a lot of people started to think about waste is not just, or managing waste is not just something that comes right at the end of a process, but it's actually something that needs to be thought about at the beginning of the process. So there was quite a few issues around packaging and the excessive amount of packaging used for particular items, what happens to that packaging, whether or not it's recycled, or the potential for recycling. So that led on to two projects, and the second one on the second bullet point on your screen is an observational study of waste management in clinical practice, and that study has been undertaken by one of our PhD students, Sean Manzi, he's just writing his PhD up at the moment, and he carried out extensive observations of waste management in two health and social care settings. One setting was in care homes and the other was a private hospital in Cornwall. And he's got some very interesting data on what enables and what stops people from segregating waste appropriately. One of the real issues around waste segregation is cost, financial cost, but also cost to the environment. So clinical waste has to be incinerated. It costs a lot of money to do that, but also that incineration process generates harmful emissions into the environment, including carbon dioxide. So big issues around, how we can actually reduce the amount of waste going into the clinical waste stream. And then the third bullet point on the slide is a project that was funded by RAP, who fund and support projects that aim to increase recycling and reuse practices. And that project was looking at the supply chain and the potential to reduce the environmental impact of the supply chain in health and social care. And it's that project that I'm going to say a little bit more about, because the process that we went through is quite relevant to looking at how you engage different groups in looking at these issues. So this project was called Raw Materials Risk in Healthcare Supply Chains, and the aim was, it was an exploratory study, and it was the aim was to develop and test a method to identify items of frequent use in the NHS that pose a high risk in terms of future availability, and to try to support decision making for future planning to secure items that could be at risk. So why is resource materials scarcity a concern? Well, I talked a little bit in the conference session about some of the resources that we use in health and social care. For example, the plastics that are made from oil-based materials, cotton, and those scarce metals and minerals that make up mobile devices, for example. There's increasing competition for resources, and there is some evidence that pediatric consultants are concerned about the potential scarcity of lithium to support mobile electronic devices, and there's been something in the literature about that and about their concerns to be able to secure supply, because if you think of all the mobile electronic devices that we use and where there's going to be competition for the minerals and resources that make up those devices, potentially people who are manufacturing medical devices are going to be in competition with computer manufacturers, for example. So increasing competition for resources. The concentration of supply in a small number of often politically vulnerable countries can cause price volatility. So if you look at all the minerals that make up a mobile phone, for example, there's no one country that you can mine all those minerals in. China produce a lot of the minerals that we use in mobile electronic devices, and the ones that they don't produce, they tend to mine in Africa. So there's potential political issues around resource scarcity. Also, there's devastation to the natural environment and costs associated with the devastation that the mining industry caused. So that can also increase the price and the cost of the minerals. And we also have a lack of suitable alternatives, and that's where it's important that we start to work with colleagues from other disciplines. And when you do the session with the multidisciplinary session with people from design and from art, you'll really get a completely different perspective of what might be available to kind of plug some of these gaps and maybe replace some of the items and the products that we're using at the moment. So, for example, if you think about when you buy salads from a delicatessen, and they come in little plastic dishes with plastic bowls with lids on, increasingly those little bowls are not made from plastic, they're made from cornstarch, and they're actually compostable. So there are other things that we can start to think about using. And there are also risks to the supply chain caused by climate change, extreme weather events and natural disasters. there was a big issue in 2012 around renal supplies, and the renal supplies produced by Baxter's, the company Baxter's, because they have their factories were in the vicinity of the Italian volcanic eruption, and they had to stop manufacturing renal supplies, and there was a medical device alert put out by the government in 2012 to say that there were real problems with supply. So it could have been that that very quickly we had to start rationing supplies that focus on renal dialysis. Fortunately, that problem was averted by being able to start manufacturing in a different factory. But you know, those kind of things, natural disasters, can actually upset the supply chain. So, what did we do in our project? Well, this is just a process map identifying the process that we went through in looking at the supply chain, and effectively what we did was we worked with Cornwall. The NHS in Cornwall, and the person who conducts all the purchasing in Cornwall for the NHS. And we took all the items that they purchase for one particular hospital, and we went through a process of taking out duplicates and filtering items to get to a point where we had a list of items that were either high cost or high use in this particular hospital. And then with an expert panel, we looked at the potential impact of those items on patient care and service delivery should those items be no longer available. And so we had a rating scale where people could actually look at the potential impact of an item should it no longer be available. So really getting a sense of what items are really important. And then I'll talk about the rest of the process in a minute. So where we got to was we found a number of items that across different disciplines. So we asked clinicians, but we also asked people involved in purchasing to rate these items, and then we looked at the consensus across different disciplines, and these were the kind of items that came up as being very important if supply of these items was threatened in some way. So I'll just give you a moment to have a look at those items. You'll be very familiar with them from your clinical practice. And if you also think about the item, but the material that the items are made from. Okay, so quite a few plastic-based items, administration sets. Urine bags, and we talked about cotton in the first session. So from these items we looked at items that were scoring quite highly on our scale across both clinical and non-clinical responders, and we put together scenario workshops, and we created scenarios around the possible threat to supply of two items. And the first scenario we constructed was around a threat to supply of lithium iodine, and that scenario really looked at the threat of supply to, and the impact that that would have on cardiac pacemakers. And the second scenario, we constructed a more of a sort of a long-term threat that was based on a risk to supply of oil-based products, i.e. plastics. So we constructed these two scenarios, and then we went back to multidisciplinary groups of people. We ran 2 workshops in 2 different locations. The groups were multidisciplinary, and we included people from finance, waste, infection control, clinical academics. We had a GP who focused on public health, and we also had someone from procurement. And we had 2 groups focusing on the 2 different scenarios. And what we did with those scenarios was we invited people to identify actions that they would need to take to build resilience into the supply chain and their service delivery. So we weren't expecting them to solve the problem of potential interruption to supply. What we wanted them to do was to identify what they would need to do in order to move towards solving the problem and providing a solution. So if you think about what these issues might be, I'm just going to pause for a couple of minutes, and maybe we can go into the chat room and you can type in what you think those issues might be.
I think 4 out of 5 are probably in there. Beth Cowan, who's joined us today for the first time, may or may not.
Okay, so we've got, it looks like we've got 4 people in the chat room plus Ray. So if you just think about when you're looking at factoring in resilience into your supply chain of items that are crucial to delivering clinical care, what might those issues be? What kind of things might you need to think about? Maybe you could type a few things in the chat room.
I mean, the alternative is also we could put Beth Cowley on microphone if she can't find the chat room. So
okay, Beth, I think we might be able to put you on microphone.
Put you on the spot. Try that. Bring the back. That's it. Red arrow. Now click down. Where are we? Attendees. Click on the plus on the attendees. Now unmute Beth Cowley. It's the top one. Right. Try talking to us, Beth.
Beth, can you say something?
No.
Okay. No. Okay.
So just
okay.
mute it again. Yeah.
Okay. Can I just get rid of all this
yeah,
again?
Just do the right red arrow to the right. That's it.
Okay.
So what's happening over here? Let's see.
So anybody in the chat room with any suggestions?
Oh, Beth's in the chat room.
Okay, that's good.
But no one's saying anything yet.
Well, you must have some ideas, yeah.
So Bonnie says,
okay.
so many of our products that we rely on are plastic-based. It's difficult to see how patient care can be delivered without it, though we waste so many items due to policy that needs following. Beth says, hello, I've managed to make it. Hi, Beth. Well done.
Well done, Beth. Okay.
So we've got a statement from Bonnie then about policy.
Yes, thanks, Bonnie. Yeah, it's interesting because there's huge conflict between infection control policies and efforts to reduce waste and increase recycling and reuse. And it may be that at a certain point there's a policy change, because obviously policy is driven by need, and the policies we have in place that are around infection control at the moment are predominantly have predominantly been driven by BSE and HIV, which has made us much more cautious. And it may be that when we start to really encounter these resource issues for real in practice, that the policy will change. But also there are other ways to think about it. Any other comments?
But Rachel is saying, check. I'm not sure if the sentence is being cut off or it's because the way I need to read it. Check guidelines to ensure we are using equipment when needed, not just because, or not just because. I'm sure.
Yeah, yeah.
And Josie says reusable items must cost and use energy to sterilise for repeated use. Bonnie comes back saying there will need to be changes to ensure we reduce waste, perhaps when we are penalised as a trust for wastage cost, not just removal of waste.
Yeah, good. And all trusts are going to have to think about their carbon reduction targets and meeting those as well. So there will be imperatives, there will be financial incentives.
So Josie had raised in the issue about repeated use and sterile.
Yeah.
I'm assuming she's concerned about the balance between reuse versus using new ones.
Yeah, I think that's a really important point, and I think often what happens is that we get into a particular habit. We think, particularly, I think, dare I say, younger people who have kind of grown up living with plastic. I mean, some of us who might have practiced a few years ago when things were autoclaved and reused and not made from plastic, have a sense of other ways of doing things. But for example, when I teach sustainability to undergraduate nurses as part of their clinical skills training, and we do these kind of scenarios, and if we take an item such as a plastic medicine pot, and I say, well, how do you use this and what do you do with it when you've used it? And it might be used to dispense a tablet to a patient and then it's thrown in the clinical waste bin. So, we have to kind of question those practices. And the kind of response I get to kind of questioning that is around, well, it's touched the patient, it's contaminated. So it has to be thrown away in the clinical waste bin. And I say, well, okay, well, what happens to the cutlery and the crockery that these patients have had? And, well, it goes in the dishwasher. So, why can't the plastic medicine pot go in the dishwasher? So I think a lot of it's about raising awareness. Okay. So moving on. So the results from our workshop are here up on the slide, and there were two main themes really, and one was around people and one was around process, and that's kind of fairly inevitable, I guess. But what was pretty important was the need for multidisciplinary teams to make procurement decisions. One of the things that we found was that although there was some consensus on some of the items across clinical and non-clinical participants in our study, there was also disagreement. So there were some items where the clinicians thought that they weren't important and the people doing the purchasing, thought they were important. So there needs to be some discussion around how these items are used and how important they are across different disciplines. And also there's an imperative really to involve people who are whose focus is on design and manufacturing and can actually think of different ways to do things really. The other theme around people was about education and curriculum development, and the need for clear leadership and management around sustainability thinking, and the raising awareness that I've just talked about, and moving away from the throwaway society. But the other theme was around process and how we can better use existing resources, but also how we can change the environment to support better practices, and also thinking about process and product innovation. Okay. And just in case you'd like to have a look at the study and the report, there's a web link there, so you'll be able to click on to that at some point. Yeah. Okay.
just so that they know. They won't be able to click on that.
You can't click on it now,
That's right.
now as you see it, but you will be able to
click on it when you get in the
when you
portal.
okay, when this presentation's up on the portal, you'll be able to click on that link and access that. And there are some resources that I've put up there already linked to this bit of the module, and I'll put additional resources up as well. Okay, what I'd like to do now, if it will work, is I'd like to show you a YouTube clip. This is a photograph of Kathmandu, where I'm heading off to next week, lucky me. There's a hospital, Bihar Hospital in Kathmandu, managed to recycle or reuse about 79% of the products that they use in delivering healthcare through very imaginative approaches. And what I'd like to do is just show you a film about that, a short film about that hospital and what they're doing. Okay, so if I just click on, you should get this.
This will be a trial to see if the video.
Oh, the video's been removed by the user. Oh. Okay.
They'll perhaps have to.
Right.
What we can do is we can put the link into the chat room and see if they can follow it themselves.
Yeah. Okay.
Some of them may have problems with YouTube in NHS hospitals, of course.
Right.
But let's. Have you read it for me?
Where's my presentation gone? Okay, let's just. No, it's gone. Okay. There might be another one. Let me just have a quick look. Where are my resources for this? Because I had another one. Oh, I'm on the wrong computer.
Yes.
I'm on the wrong computer. Okay.
It's confusing.
Okay, no, I'm very confused. I'm on Ray's computer. Okay, so that clip, it's a bit unfortunate because I was only looking at it last week or so.
It may be,
but it may be something to do with how we're running the webinar. Okay, so I mean, basically, what they're doing in Kathmandu is they have a very efficient segregation process, and they're autoclaving contaminated plastics to remove the contaminants, and then they're actually able to recycle the plastics. So they're actually recycling items that have been contaminated because they're autoclaving them at very high temperatures, and then they're melting the plastics down and recycling them and making them into different products. But they're doing a range of things, and the video kind of talks about the process and how they've gone about it and what they needed to do in order to implement changes. So at the end of the session, we'll make sure that the link is available to you, so you can have a look, because it's really interesting to see what can be done.
You put your PowerPoint back.
Okay, put my PowerPoint back. Okay. So moving on. Okay, so again, in the chat room, if you think about what issues might prevent or support waste reduction in health and social care. So what might be the blocks and enablers?
Rachel asks, are they actually doing the recycling of the plastic themselves as an organisation?
They're autoclaving it and then making it available to other people who are recycling and turning it into different products. So again, that's around linking up with different organisations and different disciplines to look at how within healthcare we might make available materials that people can turn into other products.
Bethan suggests reward incentives.
Reward and incentives, yeah, good. Just going back to Kathmandu, one of the other things that they're doing is and they are actually doing this on site, is again with cotton dressings that are contaminated. They're autoclaving those at high temperatures to reduce the contaminants, and then they go into a wormery to make compost, and then they're using the compost in their outdoor green spaces.
Rachel says infection control mainly. Josie says, I think it would help if all members of staff were aware of the benefits of being cost effective. Bethan, the blocks would be the capital of innovations. And Bonnie, I think a lot of people are, but we are directed from managers to make this difficult. I think that's referring to something else. It's going quite fast here. It might be easier.
Right, okay, that's right. Yes, yeah. Knowing how much things cost is really important, and I think it's also with what we don't calculate is we don't calculate the total cost. So the cost of buying something doesn't necessarily add in all the environmental costs and the damage and you know, the mining and the devastation to the environment, or the carbon emissions for the travel and the transportation of the items. So it's actually looking at the real costs of something. Joe's idea, some ward labels, yes, some wards label the price of on all equipment. That's really good. And having a champion on each team, excellent ideas. And also not only putting the price of the item on the equipment, but also putting the price of disposing of that item on the equipment. Because again, that's another potential incentive to reduce the use of it. Okay, so a lot about raising awareness. The champions are a good idea. The productive ward, again, that's a good mechanism for implementing some of these issues. Ergonomically, things are appalling in some ways. Yeah, that's interesting, the ergonomics, because one of the problems that came up with the packaging when we were doing our study was that in neonatal intensive care unit, they're so tight on space. This is in Cornwall, and the packaging of some of the equipment that they use was actually taking up a huge amount of space that potentially could be given over to cots. Okay, so again, that's about how we shape the environment in order to make it easy for people to make the right decision about waste management. Yeah, easier just to chuck things into the sharps bin. Yeah. Okay, so a lot about awareness there and making things easier. So there's something about making the best choice the easiest choice for people, so that it becomes automatic. You know, when we think about what we do, generally what we do at home now is our councils have made recycling so much easier for us that, you know, we automatically put the food waste in the little brown caddy, in my case, under the sink.
You're in Totnes, so.
I live in Totnes, so yeah, South Hams District Council are one of the better ones in terms of providing recycling facilities. The provision of the correct waste bins is encouraging. Yeah, I think that's really important, because, you know, when you look at clinical areas, sometimes in clinic rooms or in intensive care, you might only have one bag, and it's the yellow bag, so everything, including the newspapers, goes into it. Yeah, Devon Recycling is fab, makes it easier. Yeah, it really makes the options easier for us. So if it's easier for us to do it, we're more likely to do it. Yeah, and then conversely, a block or a barrier is where it's difficult, and the recycling options are inconveniently located. Yeah, we do it at home, so it should be easy to do it at work. Yeah, so if we've got the mindset and the attitude to do it, and the environment enables us and allows us to do it, we're more likely to be successful. Okay, so I wonder who actually knows the cost of a yellow bag and a black bag at work. Well, I do. So it would be good to have a look at, okay, in the chat room, if you can tell me the average weight of a yellow bag, the average weight of bags when they're disposed of is 5 kilograms. So if you think of what the average cost of getting rid of a 5 kilogram bag of clinical waste would be. Okay, any ideas? £30 from Zoe. Any other thoughts? 12. Okay, well it's actually less than that. It's between about £5 and £6 for a clinical waste bag. And a domestic waste bag, the same weight.
50p?
Yeah. So it's about 190. About 190. So there is a big difference. And obviously, ideally, we'd like to get more waste out of the clinical waste stream into domestic waste, but more out of the whole waste stream into recycling and reuse, but also thinking upstream, actually reducing the use to begin with. Okay, that's great. So just if we start to think about discussions for the chat room, any more thoughts or questions or comments on what we've covered so far? No? Okay, that's great.
Oh, just a positive that I think more people are aware of waste now.
Yes, yeah, that's good. Yeah, that's good. And what we do need to do now is we need to raise awareness more about where things come from, and particularly, for example, plastics, because not everybody makes the connection between plastics and oil. Okay, so just thinking about moving forward, I thought it might be a good idea for you to do a little bit of reflection on this and think about a multidisciplinary challenge, really, because I know that you have this session coming up. When's the multidisciplinary?
February 12th.
February the 12th, which unfortunately I can't be at because I'll be in Kathmandu. But in preparation for that, if you can start to think about how you might design an appropriate method of communication for a waste management message, using evidence to support the behaviour, and consider what evidence you'd use, who needs to be involved, and what kind of methods of communication and what key messages. And if you can start to think about that, and then if we can all be involved in the chat room on Wednesday, day after tomorrow. I suggest, I know it's going to be difficult because people will be working and doing various things, but if we've got that time between 10 o'clock and 4 o'clock where we can start posting some ideas and some chat and questions.
I think you just need to make it clear. You're not expecting them to be.
I'm not expecting. No, I will make it clear. Yes, so, thank you, Ray. Yeah, I'm not expecting you to be there all day, and I won't be there all day. But it's just rather than set an hour where we're all there, I thought it might be a good idea to have that range of time, and then we can just dip in and out. You know, when we've got some time, and just get some ideas and discussions going. And I think that will also help you to prepare and think about the session that you're having on the 12th of February, where you'll be meeting with people from other disciplines. And people from design don't just do product design, they also design graphics and posters. And
got a couple, Bonnie and Bethman are both saying they're working clinically that day. They were joining in. Maybe if you made it sort of like at the end of the day, in the evening or something like sort of between. Yeah.
Well, I think anytime during that day. I think maybe if we say anytime during the day and into the evening on the 22nd, and I'll dip in and out as I can, and if we go into the chat room that we're in today, the springtime.
I think everyone's in everyone. They're in everyone.
Okay.
Yeah. So stay in everyone.
Okay.
Just where they are.
Okay. So yeah, so we'll just start to get some ideas around, particularly, you know, who might be involved in helping produce something like this, you know, something that communicates messages. What kind of disciplines might be involved in that, and what kind of communication channels might you use for that? Okay. So we're just about at the end. Any more comments or questions? Or are there any, I don't know if you've had a chance to have a full look at a proper look at all the resources that we've put up for this session, but if there are any other resources that you think might be helpful, if you can email me, either email me or email Ray, and I can pull out you know, potential papers that might be of use for you.
Otherwise, I mean, you could log off now the webinar, and they could stay in the chat room.
Yeah.
For another 10-15 minutes now if they wanted to.
Okay. Yeah. You could do that.
And have some of that time thinking about your.
Yeah. Okay, so if you'd like to, I'll log off from the webinar, but if you'd like to stay in the chat room for the next 10 minutes or so, feel free to do that.
You might like to know that Rachel just said, I read one of the sustainability papers, it was definitely end of the world stuff.
Right, okay, a call to action then. It's not the end of the world, we can do things. Yeah.
So,
okay. Well, and sorry for the technical hitch at the beginning. I think we've probably got a sense of how this works now and what we need to do. Okay. Well, thank you all for your time, and I look forward to seeing you in the chat room at some point on the 22nd. Okay. Thank you. Bye bye.
So just go to bring the